Hi there, I'm Gene Ovanik, and today we're going to introduce this leverage testing device that is designed specifically for complementary diagnostic endeavors for treating lamenesses of the distal limb. Today Dr. Gail Trotter is here. Welcome, Gail. And Gail is a former surgeon at Colorado State University, and he's a very adamant student about the foot of the horse. He's had to deal with lameness issues in his career, had to treat them, and has experienced many of the same problems that we have as farriers in never completely resolving a lot of lameness issues, and oftentimes the clinical exams are not as conclusive as we'd like to have them to get the best treatment protocol. So Dr. Trotter is going to give us some of his views on this leverage testing approach, and we'll see what he has to say about that.
Well, I think, Gene, since being exposed to the device, I've kind of looked at it from the veterinarian's perspective of how we look at lameness and deal with it. And the veterinarian's purpose in looking at a lame horse is to try and diagnose where the lameness is, try and get as specific a diagnosis as you can, and then a big part of the veterinarian's role is to try and come up with a treatment plan that's hopefully going to be successful. Well, sometimes the diagnostic workup does not always yield the results you'd want. We can often localize a lameness, not have a real specific diagnosis. And the second part is sometimes our treatment plan, even though we try and adapt a treatment plan that really seems to fit the case, the results are only partial. We may make an improvement with what we intervene with, but it's not as a good enough response to get the animal back to where it needs to be, or our treatment plan, or ultimately plans as we try different things, don't work. And what I can see from the leverage testing device is that this is another tool that can help guide us, especially in a treatment plan and somewhat in our diagnostic workup, especially for the case where we've done things that we think should work and they're just not working. This can give us some new information or some different information and redirect our line of thinking and try and help us move forward.
Yeah. Well, it's exciting because I know in my sort of in the creation of this device, it's my experience over the years to trim a horse's foot and see how they respond to my work that I've done with them. And of course I've learned over the years that hoof capsule distortions are a big part of lameness. They seem to come closely associated with. We're going to talk about that more in depth in the instruction part of this endeavor here, and you'll see that it plays a huge role in it. And I think from a veterinarian and farrier participation in treating lameness, this is what Dr. Trotter has said, is he's realizing that the hoof preparation is a key factor in the end results. Yeah. And whether you're using a particular line of treatment type of shoes, pads, or whatever, the basic things are trimming the feet and getting them correct.
Yes, you bring up a real good point, and I think have already emphasized that what we're looking at here is a device to help us along the way. But from my perspective as a veterinarian and dealing with foot problems or chronic lameness problems of any kind where the foot is involved, is that one of the biggest assets that has helped me over time is to try and learn what some of those foot distortions are and how to really read the foot so I can actively participate with the farrier and trying to sort some of these situations out. And it's worth re-emphasizing that I think the shoe that you put on is considerably less important than the preparation of the foot prior to the application. And it's true here that even though we're looking at a tool that can add some real complementary information to our workup and our treatment, if we don't have the basics of foot preparation and foot balance down, we're going down the wrong path, and we're not going to get the information we need to ultimately help the horse.
Right. Well, it's always been a problem with, you hear this all the time, veterinarians and farriers not being able to agree on a treatment protocol, and it's even more complicated when you don't have a good idea of what's really going on inside the foot. Where is the lameness truly coming from?
Yeah.
So there's a lot of gray areas out there that seem to be frustrating in our communication in deciding what's best for the horse. We have ideas that we think work, and they work some of the time they don't. Well, again, it's still it's a real potential problem.
Yes.
Of the experiences that I've had in working with the veterinarians with this tool, it's become much easier because the horse now becomes a player in the some of the diagnostic stuff, but more importantly in the what are we going to do for this horse? Where does this horse feel discomfort? Where does this horse feel some relief? And with that, we're able to, everybody sees that. The veterinarians can see it, the farriers see it, the horse owner sees it, and with that, we can now develop a better plan cohesively, and it really seems to be a huge asset.
Yeah.
If you accomplish nothing more, you at least a cohesive working relationship, and I think that's what really has been helpful for me, anyway.
Well, you bring up a good point that we veterinarians and farriers always talk about the team approach and how each has to work with the other, but often that arrangement is sitting around perhaps looking at a set of radiographs, some other imaging, end product of imaging, that's sort of a static view away from the horse. I think this represents a different approach to the team approach, in that the horse has become part of the team. You're seeing what the horse, how it responds to the device and seems to interact with it, and truly everyone is getting to observe and then participate in the planning from ideas they get from the results of that testing. And I think that's a real positive, new positive approach to the team approach to lameness workup and resolution.
Yeah. Having said that, I'm going to give you a little look and see what we have here. This is a device that's strapped on the bottom of a horse's foot. We pull the shoes. We don't want any extra growth. The ideal thing is to get the foot close enoughly trimmed, and hopefully it's trimmed well enough so we don't have to do that before we put the foot in here. But we like to have this center pivot point close to the center of articulation, and Dr. Trotter's going to show you a little bit about that in just a minute or two. But the straps go around the ankle and surround the pastern area and then attach to the back side. So it's basically strapped on. Once it's held in place, this dial on the bottom can be moved to different positions from the ground surface, and it elevates the foot in this direction. And then we swing this around to the opposite position to get a counter reference. We get a reference of what they feel about this elevation here, and it's challenging the joint. It's much like a flexion test that you would do in a upheld foot that's being held up. But only it's static, and the weight of the horse is being a part of this. So we challenge the foot with heel elevation, toe elevation. We move to the lateral side, for instance, and leverage the foot. And this would be to sort of represent a horse turning a corner. And then we see what their response is to that, and then we move it to the diagonal side to see if they're painful here, if they get some relief on this opposite side. And we work around the bottom of the foot in 8 different directions, diagonal corners, front to back, side to side, and then on the quadrants in the quarter section of the foot. So basically, we're challenging the structures inside the foot, the connective tissue for the most part, and the joint itself. And primarily, we think we're challenging the pastern area. We may be affecting more of the horse proximally, but we don't know that. What we're looking at so far is just what we're doing to the distal limb. Mm-hmm. So the thing that I believe is important to know and understand about the horse's lower limb is that basically they're made up of hinge joints. They're designed to bend primarily in one direction. There's some leniency in lateral movements in the flex of the hoof capsule, and certain parts of the joint are somewhat designed so they can accept some of that load, but modern day horse is basically used in circles and in small areas, arena surfaces, cutting pens, barrel racing, pole bending, calf roping, steer roping. The whole gamut of what we do with our horses today is designed around turning corners and at high speeds, the whole thing like that. So we're challenging horses in a way that the anatomy was not designed to be challenged in, at least repetitively. So I'm going to have Dr. Trotter explain to you a little bit about the anatomy and the connective tissues that are involved in that.
Well, Gene, when we look at the bony anatomy, at least of the distal limb, veterinarians spend a lot of time evaluating tissues here in lame horses because the predominant lamenesses do affect the lower limb. Now, none of the soft tissues are in place here, obviously, but the major joints are all held together by collateral ligaments that support the medial-lateral aspect of the joint. And of course, in the foot of the horse, there are a lot of ligaments associated with the suspension and function of the navicular bone. Further up the leg, a lot of other ligaments involved in the suspensory apparatus as well. And when we deal with lamenesses, a lot of what we do is try and regionalize the source of the lameness through nerve blocks. And a lot of our nerve blocks, if we desensitize the area of the pastern or the heel and have the lameness get better, we know that's where it's coming from. And as we mentioned before, we'll try and target our therapeutic efforts to try and help resolve what's going on there. For those cases that don't respond, then it becomes ultimately becomes a kind of a lameness of unknown origin. We know its general origin, we don't know its specific tissue origin. And we can try and do a lot of imaging to try and pinpoint what tissues are involved, but that's where it can be, sometimes it ends up being a fruitless chase, and we need to come up with a treatment plan to try and make an intervention. So what we end up by default, we say some of these lamenesses are chronic soft tissue problems that we can't accurately identify. So what tissues do they involve? Well, I think what the leverage device can do, we've said we're going to put offset weight somewhere under the perimeter of the foot and then see how the horse responds to that. So like you say, it's another version of a flexion test in a way, even though we're not watching the animal trot off to see whether it makes their pain worse. So we could say, well, if you offset their weight here, and we'll say this is the medial side, we know we're going to put some strain on the tissues on the lateral side of the foot. We can't quantify it, but we're probably going to put some strain on the collateral ligaments, and in some probably non-symmetric way, we're also going to strain some of those other tissues, those supporting ligaments, as well as the joint capsule that goes around these different joints. So it's not like we're trying to say, well, if we get this pattern of loading, this is the specific tissue that's involved. It could be a group of tissues that if you put weight here and that the horse seems to like that, it seems to feel good to it. The thought processes that would start to go through your head, well, if we're overloading here, we're compressing this side, we're probably more opening, if you will, this side. Is it feel good to the horse because the increased load here, or is it feel better because we're relieving some strain on some of those ligaments? The flip side would be if standing on more leverage here makes them worse, is it because we're stretching some of those ligaments and they're the source of the problem? So I think it doesn't tell which are involved, it just gives us a global concept of this seems to be a favorable response, and these are some of the possibilities that are involved, and then it can help from there direct, are there further diagnostics you need, or will this become part of your treatment plan? Yeah.
Well, so far we've been working at this concept for several years, actually. Don't know exactly when we all said, well, let's think about what the horse has to say about this, but we've been offering horses some changes in leverage for approximately 2 years, and the results as we get more and more familiar with what we're doing and how we're to read the response that we get from this boot, we're able to give a higher level of horses more comfort by just saying, well, if they like a little elevation here, let's just give it to them and see what they think. And so we devise a little bit of a lift on that side, and sometimes we've had to back away from the aggressiveness of it. Sometimes we've had to add to it, depending on what the horse's response are and how long do you leave these things on. It's a very unusual approach. As you could imagine, if the continual, usually hoof balance is a part of why these horses get some sort of chronic long-term discomfort. And sometimes you can resolve those issues by changing the hoof balance. And we'll talk about that as we go along. That of course, is the primary thing that we address right off the bat. And most of our problems can be resolved by simple hoof balance and changes and relocating the foundation or the foot, the shoe or whatever underneath the foot in a better way. And but the horses that say, I don't like this at all, I can't even get this foot off the ground, and you swing it to the other side, on this side, and they pick the foot up willingly, those are glaring results, responses. Yeah. That's the time when you would say, well, I think I'll just give the horse a little of that for a period of time, and maybe there's a connective tissue lesion that's being aggravated. This horse has had this possibly for a long time. It's never completely gotten resolved, probably maybe because the hoof balance hasn't changed, but maybe we can treat this more effectively if we give them what they seem to be wanting. We can have the opportunity to monitor them with this in 2-3 weeks, in a month, or every shoeing period. We can monitor the progress, and this has been what our pathway in sort of being able to understand this more clearly, is that we're trying not to be stupid here. Yeah, we definitely don't want to do that. We want to be because it's a totally different approach from diagnostic perspective as well as from a treatment perspective. And with that, we're going to be very cautionary about this. And so far, we've been able to bring a high percentage of horses to a pre-disease condition in many cases, but a higher level of soundness. And I don't know where the future is, but it sure has got a brighter picture than where we've been before. Yeah. In really not knowing what we have to deal with, and the treatments, being somewhat erratic, and the results get erratic.
I think one of the struggles for some veterinarians when they first look at a tool like this is, if there's not a diagnosis that accompanies a case, that's sometimes a real challenge for us. We really want to know what the diagnosis is, and that's a noble goal. We all want to know what's present. But I think any veterinarian who's dealt with lamenesses very long, they all have lamenesses who fall into that category of lameness of unknown specific diagnosis. And they're very frustrating. So one of the reasons we want a diagnosis is sometimes if we can put a name on it, we have some things in our toolbox that we think will help it. When we don't have a specific diagnosis, they can be really frustrating. And I think we're not trying to say that you don't want to try and have a diagnosis, but I think what this does provide is it gives you another avenue, another spot to look to sort of guide your efforts at getting off center with a treatment plan, particularly with a chronic lameness or a lameness that's come back. You thought you've done the right things for, and it's recurred, or it's just a chronic lameness that's not getting better. This gives you another avenue to pursue, to try and move along and get something different done with it.
Well, that's sort of what has inspired us to look at this more clearly, because we're just not content with just saying, well, we can't fix this horse. There's been too many horses out there, older horses that have worlds of experience to give to people who are willing to do it, if they could just feel better about their job. And we've been able to do that in many, many cases, and I think that offers a huge future for really expanding a little bit more on this approach.
I really think it does, and as you've mentioned before, I think it sort of emphasizes the team approach. If we've already mentioned how getting proper foot balance is still the cornerstone of what we're going to try and do. If there are foot imbalance issues, hopefully between farrier and veterinarian they can address those. For those cases where they've been addressed and there's still problems, this does offer another avenue. And you've mentioned the point about how you follow along with these cases. I think it almost makes it mandatory for the veterinarian, farrier, and the horse owner to work in concert on these cases to say, to help guide how long some of these devices that'll be applied might be applied, when is it time to make a change, how much progress have we made, and I think it's kind of a unique opportunity to reinforce that relationship that should always be there amongst that group of people.
Well, it certainly has an awful lot of potential for a lot of different reasons, and it's hard to know where it's going to develop or where it's going to end up. But it certainly, by asking the horse and getting good information from the horse and how they feel about it, seems to be kind of a very interesting approach too.
Yeah, it's a very interesting approach, and I think it lets them be a more active participant in what's going on, you know, and that's not always the case with some of the decisions we make for them.
Yes, right. Right. Today we're here to introduce the leverage testing system that's sort of on the forefront of modern technology. So we're going to go through this procedure. We have a real nice horse here today, a perfect candidate for what we're going to demonstrate. The history is he's a 6-year-old gelding, or a 5-year-old gelding, right? And he's a working cow horse. And he's developed some issues that a number of veterinarians have looked at. They've done some radiology, both in his knees and in his distal limb, none of which have brought anything forward that's conclusive as to why he's having these issues. So the veterinarians have asked us to take a look at him from this leverage testing perspective, sort of getting out of the high-tech thing and into sort of an asking the horse type diagnostic endeavor. Not that we're here to diagnose the problem, but we're just here to ask the horse some very specific things about his lameness that the rest of the industry seems to be perplexed with. So we're going to go ahead, and first thing we do is we'll take him out and put him in a circle, take him in a straight line, do a lot of the preliminary things that most veterinarians would do, and then we'll record that information on our data sheet, and then we'll go into challenging the distal limb in various different directions, 8 different directions actually, and with that we can, and I'll show you clearly how we gain more information that can be useful from a veterinarian's perspective as well as from a farrier's perspective in treating these lamenesses that are fairly obscure and oftentimes never get resolved. So we'll go forth and see where we're at. Typically we walk them in a straight line and we look for a number of different things. Number one is we like to see how they engage the ground, how they reach up underneath of themselves, if they land toe first, heel first, or flat. And those things are all recorded on our data collection sheet. And in the end, it will be meaningful bits of information that we try to record everything that this horse does, because every step he takes has some meaning. So we also watch him as he turns. Just a subtle thing on the turn. This is a fairly hard surface, and we look at that carefully as he makes the turns. We'll ask Brady to take a corner, go in the different direction next time he comes down. Turn the other way, Brady. And I'll have you turn the different direction here again. Okay. And you'll notice he's landing nicely heel first behind. That's a very good thing. It shows his range of motion is as long as it can be. He's stabbing his toes in front. He's landing toe first. And he's a little uncomfortable turning the corner. Okay. Do you mind trotting, Brady? To me, at this point, it appears as though he's a little sore-footed. He's barefooted at the moment. He just appears to be just very careful about his front feet. We'll hoof test him And that's one of the things that we do, especially when we see a situation like this where they appear to be sore-footed. Very much out in front of himself, head's kind of down, just very careful about things. Okay. Great, thanks Brady. Now, in the history of this horse, he's recently had both knees injected and both hocks injected and both stifles injected. So there's been a substantial amount of workup done with this, and no radiology that seems to suggest any real problems. So that's why we're here. All of these different endeavors that we do are all recorded on our data collection sheet. To me, at this point in time, he seems like he's about the same amount of lameness, but I would say a grade 3 to 4, both directions, pretty much equal. Maybe a little more to the left, but darn sure lame to the right. Okay, thanks Brady. Okay, once we complete this phase of the of our workup for whatever purposes we deem results in the end, we're going to go now to, first of all, hoof testing, because we sort of suspected maybe that he was a little sore-footed. We're going to clarify that, either yes he is or not, and if he is sore-footed, then we're going to have to deal with that. If he's not, then we'll go on with the leverage testing. So, all right. Well, we're going to start with step 1 and go right on through them. So, as you can remember, we've noticed that he appeared to be somewhat sensitive on his feet. So we're going to clarify that, rule it in or rule it out at this point. So, Dale here, he's going to record all the data that we're collecting here. I usually start on one side or the other. My preference is the lateral heel, and I give a couple of good swift squeezes. There's a very small end on this, so it's very effective, so I don't have to squeeze a lot, but I'm getting a lot of pressure here, and I find this horse to be extremely comfortable on his sole. So I'm going to rule out the fact that he's sore-footed from being sensitive on the sole. I'm going to go through the frog here. Not that I'm diagnosing anything, but I just want to clear up a few of the things that veterinarians have already done to sort of rule out this lameness. Now, he appears to be very good through the frog, which is good. And so there appears to be no foot pain even through the frog at this point in time. The back of the frog seems good, so I'm going to go to the next foot. I'll swing him. We make note of the different hoof conformations as we go along here. Notice that foot was very low angle. This is a more upright foot. There's a lot more sole depth in this foot here. And I'm going to squeeze vigorously, get no response, no reaction. And I'm deep down into this very softest part of this foot here too. And I get no response. I can squeeze hard enough to make him ouch, but I'm pushing on this a lot more than I could get out of most horses. So I'm fairly comfortable with the idea that whatever is underneath of that tongue of the hoof testers is probably all right. It's okay. We have 4 different sizes here to accommodate all sizes of saddle horses for the most part. It ranges from triple odd up to 5 and 6, which covers most of the dressage horses, warm bloods for that matter. So anyway, here's basically what it is compiled of. The straps here cross over the limb, and they attach in the back part of the foot. That secures it. There's a traction on the base plate to keep the foot from sliding around. There's 8 different locations on the bottom. The wedge that's attached to the bottom has an intricate system in there that lifts and moves so that you can do it easily, yet it'll still stay in place as you maneuver it from one position to the other. The angle of this is very specifically tested to give us the best opportunity to challenge the joint in whatever position we ask it to. We've had instances when we've had too much, we've had some when it says it's not enough. This seems to be the amount of elevation that works the most optimal at this point in time. So we start out by establishing a baseline. We'll go through that again. We move the dial to the rear and elevate the foot, which puts the foot in this position, and then we get a reading from the horse, either yes or no, I like it, or I don't like it. And then after that, we'll move the dial to the opposite end, always from one side to the other. We never go randomly around the foot. We always go from one side to the other. And the reason for that is that we get, if there's a pain response on one side, or maybe there's not much of a pain response. It's a very subtle thing. And I'll show you how we gauge that with the horse's response. Whatever reading we get on one side, we get at least a counter reading on the other side. For instance, if this horse liked this foot elevated in the heel, but he disliked it here on a scale of 1 to 3, then we'd say, well, he likes this in a +2. If we move it to this side and he says, well, I don't like that on a scale of 1 to 3, then there's a -1 here and a +2 here. So there's a split of 3 within that range. So you can evaluate not only what they like, but what they don't like. And that's the nice thing about this, is that you can work a horse in a circle. Now we saw this horse go, and we saw that he was uncomfortable going both directions, but we don't know whether the other side of the foot, if elevated, is going to benefit this horse. That's where we can get another set of readings off of this boot that you don't get with just simply circling in the most common diagnostic endeavors. This seems to be what most veterinarians are really looking for, is another part of that equation. And that's oftentimes the part that's missed, is that you say, yeah, the horse is painful here, but there's another part of that that says, well, what makes him happy? And that's where asking the horse may be the most beneficial thing that this boot can do. The nice thing about this is that the horse owner usually participates in this leverage testing system. The farrier, the veterinarian, and the horse owner. The horse owner can tell more about the horse. If they're really in tune to their animal, they'll know more intimately whether this horse likes it or dislikes it. And sometimes the more subtle readings that we get are the most important, reading from one side to the other. So with that, we're going to go ahead and apply this to the horse. We'll go through the procedure in a very systematic way, and if you follow these guidelines, you'll gain information that you, for a lot of horses, just never believed would be possible. So we're going to ask the horse what they think about this lameness issue. Okay. It's helpful to have some help with this system. You can do it by yourself, but it's helpful to have either the veterinarian or the owner. In this particular case, we have Brady here, Brady Hanna. He's very experienced with this system, and we have a scorekeeper over here, which can oftentimes be the owner of the horse. So it's best to move through this thing systematically, so it's nice to have the extra help. So what we're going to do, we're going to test the left front foot first. Typically, we take the leg that is indicates the most lameness. I'm not sure which of these in our circling out there was the most lame. My interpretation is kind of there's more wrong with the left than the right, but I'm not here to diagnose any problems. So if you start with whatever leg, it's really immaterial, but my preference is to start with the leg that's the most lame. Okay, so to get a baseline, and here's how the baseline works. I need to know what it takes to get this horse's foot off the ground as he is, no shoe, barefooted, in the way that he's been presented to us. So I ask the horse in a systematic way. Now, I have a certain way of doing this. Everybody is going to develop their own way. Whatever way is common for you to pick up a horse's foot, that's what you want to do. But you want to do the same each and every time. I pick up horses' feet all day long, and I find that if I place my finger right there and ask them, just put a little pressure on it with the tip of my finger and oftentimes my fingernail, I can get an idea of what it takes to get this horse's foot off the ground. I'll do this 2 to 3 times so that the horse becomes familiar with me and how I approach lifting his foot up. So, okay, so I place my hand, ask him. It's like anything else. Place your hand and then ask him. And as I'm picking this up, he's unloading that other foot. I want you to keep your focus on those things as well. How he picks up the foot, how long he's willing to hold it, how quickly he puts it down, and then how fast he comes off of that other foot. Those are the 3 things, 3 indicators that we use in our quest for asking the horse. Now, if he struggles with picking this foot up, that's a meaningful bit of information. How long he holds it up is another part of that meaningful information. If he puts his foot down quickly, or if he just suspends it, doesn't come off of that other side, that's meaningful information. If he comes off of that foot quickly, then that's another part of the recording process that has meaning in the end. So that's basically what we do. The owner of the horse, standing at the helm up there or in the front, can nose their horse usually, if they've had the horse very long. They know when this horse is painful and when they're not. That's sometimes the best information that we have, is what the owner tells us. They know this horse doesn't care for that, or he seems real happy with that bit of challenge to his distal limb. So keep in mind all of those things. It's a very subtle thing on the very subtle lamenesses. The lamenesses that are very chronic and are, for instance, like this horse, I mean, he may show us that there's very much a painful situation when we leverage in a certain way. So sometimes it's very evident, sometimes it's not. But it's the combination from raising each side of that spectrum that gives us the best information. So, one more time. Fix it up, hold it for 1 to 2 seconds, and then put it down. Watch the other leg to see where it goes. Okay. Brady will show you how to cross those straps over the top. You'll reach underneath, pull it over, and come clear over to this other side. It's a wraparound system. It's going to do the same on this one. And it doesn't have to be real tight. Okay. And it's always set up to elevate originally. That's what we do as our first leverage endeavor. You can see the straps come clear over the top of the foot and cross over and go clear to the other side. Same with this side here. There's a hardened surface in here that keeps it from running off the foot, and the no-slip surface kind of helps with that as well. Occasionally, horses don't like to have things strapped to their feet. Sometimes they'll put it here, put it here. Don't misread that bit of information. They sometimes just need a moment or two just to get sort of oriented to that thing being strapped on their foot. Now we'll ask the horse what he thinks of that bit of raising the heel here in just a second. He's very complacent with that, doesn't seem to be bothered by it. Hind feet are oftentimes more of a problem. We've leverage tested a lot of hind feet, and horses aren't quite as apt to stand and accept it as they are on the front. So just be aware of those subtle things as you apply this to a horse's foot. They just sometimes are a little reluctant to just be terribly comfortable with it. So once I see him settling into it, I see him place this foot out here, I'm going to go back, place my hand here, ask him to lift it, accommodate him, hold it 1 or 2, and I see him about the same as the baseline. 1, 2. Okay, I got a little bit of sag there. He's coming off of that with some sort of urgency. Ask him again, and if you third time, and if you feel like you need to ask him a 4th time, go ahead. I want to know how quickly he puts this foot down, how quickly he comes off that one. Now, he wasn't quite as quick to come off of that, so I'm going to say that's very close to the baseline. There were so many inconsistencies. He didn't come off of it once, he did come off it. Brady?
Yeah.
ask somebody who's familiar with it, ask the owner of the horse what they think, you know, and from that you get 3 different opinions. The veterinarians are oftentimes the most help in these situations because they look at these things very carefully, and I think they need to be a part of this equation. As I mentioned, the veterinarians were the ones that asked us to do this to help with their endeavor to get this horse through it. Okay. Okay, it's quite quick to pick it up, and he seemed to come off of it about like he did on his baseline. Sometimes when you're not completely sure, sometimes you just wait for just a second, pick it up again, and they'll give you a good shot at it. Okay. As I mentioned, we swing it to the other side of the dial, and when you make a change, they'll fuss about with it sometimes. They'll move the foot around because it's such a, you know, it's such a drastic change. So, okay. With that first encounter with the leverage, we're going to ask our scorekeeper here to write down the score on the data sheet. So, okay. So we'll give him a chance to settle into it. I asked him a little bit here. Okay. He seemed pretty willing to pick it up. He didn't jump off of it, although he did come off there. Ask him again. 1, 2, 3. I'm looking more at how he comes off of that other side, and he doesn't seem to be in a great hurry. It seems to be more like a baseline. Would you agree, Brady? Okay. I don't think he's bothered by that. And so I'm going to have you write down a baseline to 0. Okay? 0, 0. Okay? Okay. The next step that we go is to the lateral side, right through the middle. We're going to try to let him settle into this. Keep in mind, this is where he was uncomfortable in the turn to that side. So we're actually simulating that turn to the medial side of the picture. So I'm going to give him just a second, and I'm going to ask him to pick his leg up here. Now you notice he's pushing it way out to the side so that he can minimize the leverage. If he pushed it in next to him, that would increase the leverage. So when they take the approach that they want to move it out, it means that they're adjusting the joint for some comfort. That all is a part of this equation. So I'm going to ask him here. He's not giving me any response. I'm being more assertive. Each time I'm more assertive, the numbers go up. I'm reaching a point where I can't get his foot off the ground. I'm becoming very assertive with my fingernail, and I can't get a response. Okay, so that would be a -3 on a scale of 1 to 3. He's showing me that yes, that is uncomfortable. Okay, now that's all fine and well. You know, we saw that in the circle. The thing that is most helpful about this boot that we find consistently or quite frequently is what he will do on the other side of the scale. So the lateral side gets a -3. That's on the high end of the scale. Okay, Brady, we're going to move it to the medial side, and especially in cases where you get a high score like that, you often get an equally high score on the plus side. It's not always the case, and you never want to read into this any more than what the horse actually tells you. And you don't want to falsify any information. You need to listen to the horse. The owners need to be a big part of this. And if you look at where he's at here, he's seeing something off to the side, and he doesn't seem to be as concerned. These are all little meaningful things. We find it very interesting in these different changes in the leverage boot and the horse's focus on what they feel good about and what they don't feel good about. And it seems like when you start reaching for areas that are painful, they get really calm and they try to detour that pain as much as they can. It's very impressionable to them, especially under the chronic pain conditions at a level 3, for instance. Another part of that, if there's another part of that leverage test that says, yes, this feels real good, you'll find them lose their focus. They'll get off onto something else because the pain is just not there. And those are all meaningful bits of information. The horse owners, again, are really helpful in this respect. So they know their horse, they know when they're attentive or not. So I'm going to ask him to pick up this leg, and I ask him in the same way as I did before. I ask, touch him, squeeze him, and he seems like very much of a baseline. He's slow to pick that leg up. He's standing on it with a certain amount of comfort. And he's not in a big hurry to put it back down. Strikingly, much different than is on the other side, okay? He's licking his chops here, he's looking around, and you get these kind of responses a lot of times, you know. They can really tell you what they're thinking. All right, the next step is to go to the lateral toe.
So where do we score that, Gene?
That would be a +1, I would say, huh? Very close to the baseline, but you know, the thing that was different about that was that he didn't come off of it like he did on the baseline. He hung in there on that, kept it loaded. Okay, similar to the other lateral position, the lateral toe, it's probably a little more challenging on some cases. However, you know, if you look at the anatomy inside and you're challenging different components of the coffin joint, according to the veterinarians that we work with that helped us with this boot, there's suspensory ligaments and joints themselves and all of these different things. So each of these little different positions is addressing another part of the coffin joint. So with that score, we can then confer with the veterinarian and come up with some more data to help form a better diagnosis and, of course, a treatment plan as well. So I'm going to ask him, now that he's settled into it, and he's a little more willing to pick it up. He's off of it very quickly. He's going to try to reposition it so that it's more comfortable, because he knows I'm going to ask him again. He's going to find a better spot. And he's off of it very quickly. I have to ask him once, have to ask him twice. I get a little more assertive each time. Another time, he's losing interest in this. He's not very happy with it. And I'm asking and I'm asking, and I'm pushing hard, and he's very close to not wanting to pick it up at all. So that's not quite a 3, but it's a 2. Certainly a 2. Okay? Because it's slightly different than the other response. Okay, we're going to go to -2. That's right. So we're going to go to the other side. Medial heel raised. Okay.
You want to step him up a little?
Yeah. Okay. Keep in mind, as you ask the horse to lift his leg, you want to be the same, consistent every time. Ask him by placing your hand here, put your finger in there, ask him. Sometimes that's a meaningful 1, 2, 3, 4. You know, the more you ask, the higher the scale goes. So ask him, he's starting to release, pick it up. That's why we do it 3 times. Ask, push. I got that part of the equation. 1, 2, 3. And he's coming off of it, not in a big hurry. So he's not, I would call that somewhat of a baseline. Would you?
Mm-hmm. I agree.
Unlike the other part of the leverage test where we leverage just the side, he gave us a +1 or +2 on the medial side. -3 out here, +2. This side was a baseline. The lateral toe was less affected. So those, by the time we get through gathering this data, we're going to be able to come up with a better plan as to how to deal with this horse, I think. At least we have in the past, okay? Okay, Brady's going to move it to the medial toe. Okay, that was very easy. Keep in mind, watch that foot over there. I'm going to ask him. He still seems to be staying in that mode there. 1, 2. A little reluctant to pick it up, however. That's why I'm going to have to do this once or twice more, okay? And the reason why I say that is because he's not unloading that foot when I put it back down. So it's important to be able to ask, 2, and that was a little quicker. I'm going to call that a -1. Would you, Brady? Okay? So the reason why was because he was just a little reluctant to pick it up. He sort of stayed on that fairly good, but it was at least difficult, more difficult to pick that up. So, but the fact that he stayed on it was good. Okay, we're going to...
He isn't real excited about unloading it.
He stays in it, doesn't he? Yeah, that's very interesting, and that's not for us to know what that's all about. It may surface in the end when we compile all of this data and we confer with the veterinarian or whoever is going to help us with this information. So I'm going to look at this as a positive maybe. He started licking his chops just a little. I'm going to ask him here. 1, he picked it right up. Okay. He did come off of it. 1. It's very similar to the baseline. If you remember, he was put the foot down, not in a hurry, but he did come off of that one to sort of equalize things. So I would call that a 0, right? Great. Okay. That's completes our endeavor on that foot there. Okay. Now we'll move to the other side. Anything on the lateral side, most anything on the medial side was good or to the baseline. So with that, we're going to go over the data and set up some sort of a shoeing prescription with the help of our veterinarian, consulting veterinarian. We're going to see if we can come up with a game plan to help this horse through his issues. How long this lameness has been in existence is a part of the history that is entered into this equation, and is it progressive or has it been subsiding? All of those things are helpful bits of information. All the radiology information and things are the things that you compile to develop a game plan. The thing that's really interesting about this is that you know, from a horse owner's perspective, it's a fairly open-ended sort of helpful tool to say, does my horse really have some issues? Does he have some problems? And with this, you know, they may be subtle in the arena, they may be subtle in the turns out on hard ground, but this seems to bring out the more profound potential lesions or problem areas. And of course, the nice thing about it is that you have a way to sort of help treat them from a farrier's perspective. If they didn't like this and they like this, then give it to them. That seems to be kind of the magic in what we're going to hopefully offer this horse. Okay, we're going to go through some of the leverage testing stuff and developing a plan for treatment. What we're seeing is there's a a plus on the heel lift. Medial heel lift is a plus. The medial side of the foot is a plus. The toe on the medial side is a 0, meaning these are all favorable elevations. The lift that occurred at the toe is a minus, meaning he liked it less when we leveraged his foot backwards. The lateral toe was even more painful, and right through the widest part of his foot it was the most painful, and it was even painful in the heel region. So when you compare the two across from each other, you see that, let's start with the one that's the most painful. That's the -3, and on the other side we give him a +1. So it seems only reasonable that if we raise the inside a little bit, for whatever reason and for whatever length of time, it would be helpful and in getting him treated. And same is true with the heel. Anything that seemed to occur in this region here as far as elevation was appreciable. Everything on the diagonal side across from it was extremely painful. So that's a simple way of looking at the data that we've collected and how we're going to approach a treatment plan. I'm going to prepare this right front foot. I'm going to map it out. There's a protocol that we've developed with this system of treating that addresses hoof preparation and hoof evaluation. And what we know is that parts of the foot that have the biggest curve in them are generally the high side. One side could be taller than the other, just in general hoof preparation or in growth. And a lot of it is that the hoof never gets a chance to really get worn away. What we see here is that the sole is really close to the ground surface of the hoof wall here, and there's a bit of space over on this side. And we're going to look at the curvatures of these heels initially. You look at this general curve here, and certainly it has some bend in the back, but this one actually bends from clear up here. So we're going to record that and exfoliate the foot. We know that the sole is our best guide for knowing where the bottom of the coffin bone is. So we're going to prepare this foot not out of balance, but in balance as best we can, to ensure that whatever we put on this foot will be at least compatible with the ground surface of the coffin bone. As you can see, the view that we've taken down this way on the horse's foot exhibited a near solid surface, or the equal surface from this toe quarter to the level of the sole, and it seems to be more in this way. These feet tend to grow a lot. You'd think that a horse that lands on the outside of their foot would tend to wear that side away, but typically they don't. The loading forces are on the inside of the foot, and that's where a lot of these horses are taking a hit. That's why we try not to imbalance them at least until they have a reason to, and we never imbalance them from the sole plane perspective, only from a treatment protocol. So what I'm going to do is I'm going to scratch the surface a bit more to see if I can find any evidence of chalky material similar to what I found over on this side. And so far I am not experiencing anything like that. Okay. I'll start out by mapping this foot out. I'm going to use this is our beginning spot for evaluating the foot,
We use the central sulcus, the length of the central sulcus, to determine the full length of the frog. I've got a exfoliated frog there. I'm going to we know that the reference to the widest part of the foot, and that's what we're looking for here, is to find the widest part of the foot, place the shoe around that equally proportioned from front to back. So to find it accurately, we have several different ways of doing that. One is to measure back 1 inch from the apex of the frog to find that reference. Where the bars terminate into the commissures is the second reference, and the true arc at the widest part of the sole is the third reference to finding the widest part of the foot. We know that that's in close proximity to the center of articulation, so placing the shoe around that equal proportions is what our goal is, and this establishes a baseline from a shoeing perspective. So the bars terminate into this swell. You can see the swell here, and the arc on each side of the foot. As I'm looking at this, as you look at this, you can see that the sole is touching the rasp on this side, and there's a huge gap underneath this other side. So with that, we're going to be able to look at the sole from that perspective. I'm going to run the rasp in line with the frog and pull it perfectly lateral to that, and where that line bisects itself equally is going to be my reference. Connect the two lines. One inch back. Where the bars terminate, the widest arc establishes where my widest part is. Once I've established where this widest part is, I know from research that I can measure forward from that point, 1 3/4 inch on a sized foot like this. That's going to be the tip of the coffin bone, and 1/4 inch ahead of that is going to be where I would like to have the breakover point. The pillars of the foot, and you can feel them right here. There's a little swollen area here, a little cup that denotes where that pillar is, and breakover should be about there. The actual shoe will come equal proportions, equal parts from this line to that line. Okay, so I've mapped the foot out. I have now a game plan, at least, to establish what is distorted and what's not distorted. What I've evaluated so far is that this distance here so far is shorter than the distance from where the front of the shoe is. My goal is to have this distance there equal proportions to the front part, and then of course have the breakover be slightly shorter. You can see clearly that this heel in the depth from the wall, from the ground surface of the hoof wall and the sole, are much higher than it is here. So I see some height in this region and height in this region, from this point back to here, and from this part back to here. So what I've determined from this is that if I trim this horse's foot exactly to the level of the sole from this perspective and from this perspective, and lower this and lower this, then I'm going to have the hoof capsule quite close to the exact surface of the coffin bone. Okay, it's highest in this region and in this region here. It's the right front foot. Okay, this is the lateral side. There's the highest leverage painful area is on the lateral side, and as we look at the plane of the foot, we can see that this horse's foot has been allowed to grow a certain amount of height on this side here. So in our game plan, we can eliminate some of this height that was represented by the leverage tool simply by getting rid of some of that leverage. The fact that there's a a -3 here, a minus on this corner here, a minus out here, tells me of a magnitude of 2, 3, and 1, tells me that I need to elevate this even more than what the foot's going to give me. If this was a 1, a -1, and a +2 here, or a +1, or a baseline, I wouldn't worry about it because I have enough hoof there to make the difference. You see how that works? So how the hoof is trimmed and what you have to work with are factors in how this treatment is gone. There'll be more information about this included in this package about how to address the foot, hoof trimming principles, how to accomplish these things, and it's all going to be easier to look at this data sheet and then apply the hoof preparation based on what you find, what parts of the hoof are distorted, what parts aren't. Okay, so I'm going to take this heel just a little bit, and you'll watch as I trim that heel, you'll see it go from that sharper curve to a straighter heel, and it doesn't take much to change it. So this heel being more curved, it's going to end up straightening more. It's going to end up down here, and you can see where this wall is much straighter at this point here. So I'm going to start on just the heel part. See how that heel is becoming more straight, very much like the other one. I'm going to take it down so that it's about the same height level to the sole as this other side. Okay, and we have two conformations, heel conformations, that are now fairly similar. Okay, I'm getting the distortions out of the foot. Follow this line back here, and this distortion ends up clear back here, so I'm going to follow it all the way to its termination point. Same is true on the other side. My goal is to get the wall uniform to the level of the sole from this level here out to there, equal proportions on both sides, all the way around. That way I have a true image of the coffin bone, and from that I can place the shoe on there and place it these parameters and have the best possible chance of being first of all level with the sole, medial-laterally, and from a side-to-side perspective. So I'm going to take just a little bit more off here. This wall is just a touch wider. There's the widest part. You can see how where my heel ended there before, I have a little mark right there. The heel was there and I moved it back by the way I trimmed it, which has increased this distance here, widened it as well, and made it possible to get this divided up equally from front to back. Very nice foot. It's been well taken care of. Okay. We've got the foot trimmed, and we've prepared our most common treatment tool here is a shoe called a PLR. And the reason why it's called a PLR is because it's a performance shoe that reduces the leverage around the perimeter, and that's real helpful in all horses that turn corners. As you can see, the highest part of this shoe is on the inner rim inside of the nail groove, and it allows horses a bit more freedom. Approximately, according to the research, about 20% or more of the strain in turning is reduced by using a shoe similar to this here. And of course, the farther in you get with this breakover, the easier it is for them to turn. So we have also a rail on here which is adjustable. We've got the holes drilled and tapped for this.
it has a stabilizing pin here that fits into this hole, and of course a screw that attaches it here. We can modify these. We can grind the back off and move this high spot up here. We'll take a taller rail and do that. If you look at the leverage testing that we did, he liked higher lift here in the center, not so much in the heel. So we can move this high spot forward by just simply modifying this through here. We have 3 elevations. This is the low one, as you can see. It's and then we also have a taller one. So we can do all of these adjustments once this shoe is on the horse. We've used a flat pad with a frog insert on it. If you remember, we tested his frog, and it seems very happy, very sound and solid. We can load that frog if we need to by adding whatever to this, but nevertheless, there's a bit of distance in this. We'd like to make some sort of frog contact to maintain good foot function. So we'll pack the foot with some material that will enhance the quality of the inside of this, keep it flexible, soft, and hydrated, and through the treatment process. So we have some options now that correspond with the leverage testing, and I think that's what we are offering this horse. Over a period of time, if we use a taller rail, we'll reduce the height of this. We'll re-leverage test him, do all of the things that the horse tells us we need to do to give him the benefit of treatment. So we'll put this on and go from there. We've developed a plan that we think is going to be helpful for him. We're going to ask him what changes we've made so far. We've made some hoof preparation changes, but typically with that high scores on the negative side, we generally don't get as much, all of the resolved issues taken care of. So we're preparing to add some rails to that shoe in whatever design is necessary to make him as comfortable as we can get him today. So we're going to see what changes we've made and how it affects his way of going right now. The changes that we've made are, number one, the hoof preparation give us a little bit on the lateral side, which was the painful side lifted, and reduce that. That should help. The type of shoe that we've used as a base should help because the perimeter is in a little bit, and that should reduce some of the strain in his turns. So with that, we're going to go ahead and see where we're at, and then adjust from there with the rails. It seems like we've made some change, at least from my opinion. We've been able to get a little flatter landing with the left front foot, even though we took quite a bit of heel away and didn't add anything back as far as a wedge is concerned. But we've managed to give him just a little bit better landing. Most of that, we think, comes from where the breakover is at, so that part maybe is of some help. He still has some difficulty in the turns. I'm not sure it's any worse. Could be a little bit better. And I think the trot's better. I really do. All right. So I believe that we've helped him at least 10, 15, 20%. I'm going to be conservative with that, so. Okay. Now we'll try him in a circle, Brady, and this will be the final test. Well, before we shod him, the turns were a grade 3 or 4, and it seems like they're better now by quite a little. They're actually down to about a 2, especially going to the left, and that was his worst way. So, and that was the foot that seemed to be problematic through the whole process. All right, there seems to be a substantial improvement. It went from a grade 4 on the turn back to probably a 2, so that's a big improvement. And we'll see if we can't get him a little bit better with the rails. Remember, that was his turns to that direction in lifting in the leverage testing were on the highest end of the scale. So let's make some adjustments and come back and see where we're at. Okay, thinking back at the leverage testing, and where he felt more comfortable was raising the medial side in the center more than the heel. His most painful leverage was in the middle on the lateral side. He got most relief on the inside, medial side, in the middle. So we've modified this tall rail. This is the tallest one, and then we've taken it by making the high spot here, tapering it back here from both directions. So what that does is it moves that pivot point slightly forward. Now this in the eyes of many people who are both farriers and veterinarians find this to be a very radical approach. And when I first started this, I agreed. I thought this is a unreasonable thing to do for a horse. Yet I look back at the history of my treatment of lame horses, and I see how a lot of these issues never get resolved. And I tried this. We've got a large number of horses now using this approach, and the number is getting larger and larger. What we're thinking is going on with their consulting with the veterinarians. We're finding that 24/7 these horses are getting relief. When they work in an arena surface that's properly prepared, the challenges are not that great. Lesions, as we hear from the veterinarians, don't heal easily, especially if they're aggravated. And I think what we've done here is to provide them with some sort of relief 24/7, and carrying that through in the softer surfaces when they're challenged the most. This gives them relief even in the hard turns that they have to take. Now, that seems like a lot, but the thing is, we've just given this horse what he appears to want, and especially on this broad scale of real painful and a lot of relief on the inside, it seems like a reasonable approach. We'll reassess this in 2 weeks. I don't like to leave a horse with this much elevation for any longer than I absolutely have to. I'll reduce this as quickly as he says that I need to. I'll check the lesion. I have now a scoring sheet that tells me where he was at, and from that I'll be able to reassess this treatment protocol and plan as we go through this. Typically in 2 to 3 weeks we'll reduce this down. We try not to stall rest the horse completely. We'll keep him ambulatory, and we'll put him back to use as quickly as we can. It's been our policy and our feeling that that most of these horses heal better when they're being used, as long as they're being protected and helped with whatever lesion is going on or wrong inside the foot. If we can help it this way, it seems to heal much better and more faster. So that's kind of the plan, and so we're going to approach it from that perspective. So, all right, so I'm going to offer this horse a little lift right there. If I wanted to, I could raise this side. If for instance, the leverage testing and he wanted more elevation and heel, I could add a lower rail here, which would help him turn even more. And so I have those options available. The shoes are drilled and tapped for that purpose. So I'm going to put his foot down now. And I want to test him here too to see how he loads that, and he seems like he's settling into it pretty good. I'll just subtly ask him what he thinks about that. And it sure didn't take much to get him to respond. Okay, so it's a constant thing of asking the horse each and every time you do something with them.
in this respect. So. Keep in mind this is really hard ground that he's on, but also notice that in the turns on the end, much different than when he was barefooted or even in our first run here. And he's looking around, not as concerned about his aches and pains. Very little to no hesitation on the turn. Now mind you, that's a lot of rail on a hard surface. You'd have to be sensible about these things and where the horse is being housed, what kind of run they have, what kind of free areas they have to run in, and how that rail is going to affect him. We certainly don't want to overdo anything, and that's the big concern of most anybody who's not familiar with this system, and we certainly are concerned too. And every case is going to be different. Come on, the back on the grass. Okay, as you can see, the horse has still got some issues. The improvement is substantial for sure, and we don't always get this kind of response, especially from grade 4 lameness on the circle, grade 4 out of 5. And even the short turns are much resolved, and on hard surfaces it's quite a nice improvement. The real treatment comes each day that he stands on those and gets some relief from our static leverage system. You saw the results of leveraging to the lateral side, the relief that he got. He's going to get that same kind of relief every day of his life until that issue is resolved. The veterinarians will eventually figure out what structures are involved there. That's not my job, it's their job. There's a lot of diagnostic tools out there. There's MRIs and ultrasound, radiology of all kinds to help with finding the real problem. The thing that seems missing in a lot of treatment protocols is asking the horse where they really hurt. And most importantly, not just exactly where they hurt, but what makes them feel good. And if you can make them feel good and give that to them 24/7, they're eventually going to heal sensibly. They should heal what's gone wrong. Now the follow-up on this is going to be re-leverage test him in 2 to 3 weeks, see how he's doing, monitor all of those things, put him back to use at a reasonable, sensible rate when it's possible. Usually we try not to do anything for at least a week and then reevaluate the situation after that. Try to reduce the height of that rail
as quickly as possible, that's always the best call. It just seems unreasonable in many eyes to raise a horse that much, but it's been very successful, and I think it's opening new ground into the treatment protocol. But without the leverage testing tool, you would never be able to get an appreciation for what's possible. And I think we've just begun to scratch the surface on what's possible. And I think a lot of these long-term lesions have never become resolved because there's never been enough diagnostic endeavors to be able to see the picture more clear. And I think the missing link is just the fact that we've never been able to ask the horse in a way that we can now. So with that, we're ongoing. We're going to learn more as time goes on. But right now, asking the horse seems to give us the best information that we have available to us now. Thank you.